Hello everyone, and thank you for joining this presentation. I'm Bill Kapralos, a faculty member and researcher within the Game Development and Interactive Media program at Ontario Tech University in Oshawa, Canada. Today I'm going to take a few minutes to talk about our work in progress on a serious game designed to train mental health professionals in psychedelic psychotherapy, and I'll be speaking on behalf of my co-authors, student Gary Liu and researcher Dr. David Chandras. Psychedelic psychotherapy has accumulated a compelling body of clinical evidence showing efficacy for conditions such as depression, post-traumatic stress disorder or PTSD, and addiction across multiple randomized controlled trials. It's also growing in interest. Despite the growing momentum, there's a real and urgent problem, and more specifically, there's a significant shortage of trained psychedelic psychotherapy practitioners and accessible evidence-based training tools. And this gap is what has motivated the development of our serious game. The psychedelic psychotherapy serious game employs a visual novel format whereby the trainee takes on the role of a physician at a small mental health clinic, and they interact with virtual patients through branching narrative scenarios, and they make evidence-based treatment decisions. The serious game currently employs two modes. In Explore mode, trainees freely investigate treatment options and receive immediate feedback without penalty. In other words, the Explore mode was designed specifically for safe, curious learning. In Score mode, trainees are assessed, and we're examining the potential of providing trainees with a micro-credential certificate that's aligned with continuing professional development standards. The trainee objectives are as follows. 1, select appropriate treatments. 2, justify those treatments with evidence-based reasoning. 3, account for patient-specific factors such as age and comorbidities. And finally, 4, navigate relevant legal and risk management constraints. The serious game interface. Currently, the interface has 3 panels. On the left, a virtual patient profile with presenting concerns, basically information about the patient. In the middle, a selection of clinically established treatment options for the patient. And finally, on the right, immediate feedback with supporting clinical citations. The interface is designed to mirror real clinical reasoning as closely as possible within a game format. Virtual patients and game mechanics. The game currently features 6 virtual patients organized across 3 difficulty clusters. At the easy level, Marianne presents with treatment-resistant depression. Bobby Taylor presents with PTSD. At the medium level, Aaron Stewart deals with alcoholism and Margie Adams with eating disorders. And at the challenging level, Cole Cassidy presents with obsessive-compulsive disorder and Aya Maguire with suicidal depression. Each case was generated using AI with peer-reviewed source constraints, cross-validated by a second language model, reviewed by a psychedelic psychotherapy expert, audited for demographic bias, and finally signed off by a 4-clinician panel. The pedagogical designs of the game draws on established frameworks, and more specifically, we employ branching decision trees for situated learning, reflective choice review for deliberate practice, and progressively increasing complexity that's grounded in cognitive apprenticeship principles. To summarize where we are, our conceptual design and early development have been completed. We have 6 virtual cases that have been expert reviewed, and our visual novel engine with both game modes has been implemented. However, the game has not yet been empirically evaluated, and that's our next major step. Evaluation will begin with usability testing, followed by efficacy testing with pre and post type testing paradigm. Our broader argument is as follows. Serious games, when responsibly designed and rigorously evaluated, can play a meaningful role in preparing the next generation of psychedelic psychotherapy practitioners. Thank you for your attention, and I'm happy to take any questions. And if you'd like to follow up, please reach out to myself or Dr. David Chandras. Contact details are provided on the screen.